If you're in your 50s, 60s, or even 70s, and when you wake up in the morning, the first thing you notice isn't feeling refreshed, but stiff knees, heavy hips, or aching hands when you try to open and close them, then there's something very important I want you to know. That's not something you're just supposed to accept because of age. In my clinic, I hear the same question all the time. Doctor, I'm not doing heavy work anymore. So why do my joints still hurt? The truth is, joint pain in older adults rarely comes from just one cause. It's not only worn down cartilage, it's not just low calcium, and it's definitely not as simple as take a pill and make it go away. Most joint pain is the result of years of low-grade, hidden inflammation combined with weakening muscles around the joints, slower blood circulation, an immune system that reacts too strongly, and especially a digestive system that doesn't work as efficiently as it used to. That's why so many people notice pain meds help fast, but the relief doesn't last when they stop the medication. The pain comes back, sometimes worse and over time. They need higher and higher doses. My name is David Warren, and I'm 60 years old. I've worked with older adults for over 30 years, and honestly, I've been there myself. Knee pain when climbing stairs, a stiff lower back every morning, aching hands when the weather changes. What changed things for me wasn't stronger medication. It was understanding one core truth. Joints don't need to be shut down. They need to be rebuilt and supported from the inside. When you give your body the right foods in the right way at the right time, your body can naturally calm inflammation, reduce pressure on your joints, and support tissue repair far better than most people realize. In today's video, I'm going to share a group of very familiar foods many people eat every week, but don't realize that when eaten the right way, they can help. Reduce morning stiffness, calm chronic inflammation, and help you move more comfortably without relying on pain pills. They're not miracle cures, but they are a strong, sustainable foundation for healthier joints after 50. If you're looking for a safe, long-term approach that actually fits an aging body, stay with me. Part 1. Legumes that support joints from the root. Slow relief, deep impact. There's a common misunderstanding I've heard for years in my clinic. Doctor, beans are just carbs. If I eat too many, my joints hurt more. The truth is, beans don't cause joint pain. The problem is choosing the wrong type, eating the wrong amount, or preparing them the wrong way. After 50, joint pain usually doesn't come from sudden injury. It comes from long-term, low-level inflammation that builds up over years. It's like a small fire, not dramatic, not explosive, but constantly burning in the tissues around your joints. Certain legumes, when eaten correctly, can help calm that fire from the inside. Not by masking pain, but by reducing the inflammatory signals your body keeps sending. When joint pain becomes chronic, the body often keeps inflammation signals turned on at a low but constant level. These signals cause mild joint swelling, tighten the tissues around the joint, and make joints feel stiff and heavy, especially in the morning. Some legumes are rich in soluble fiber minerals that help muscles relax plant compounds that fight oxidative stress. These nutrients help feed healthy gut bacteria, calm the immune system, and reduce inflammation that spreads to the joints. That's why many people say, after eating this way for a while, my joints feel lighter, even without extra medication. When these legumes are eaten regularly, many of my patients notice less stiffness when they first wake up, gradual reduction in dull, aching pain, easier walking and standing up from a chair, less need for extra pain relievers. The key thing to remember is this: the results are slow, but they last. If you're over 50, start gently. About half a cup of cooked legumes per day. Eat them at lunch or an early dinner. Drink enough water throughout the day. Prioritize well-cooked, soft beans, low salt, no processed meats on the side. Avoid overeating in one sitting, eating them too late at night, pairing them with sugary sauces or desserts. I often tell my patients, your joints don't need to be forced into getting better fast. They need patience and daily support. If you've eaten beans before and felt uncomfortable, don't assume they're not for you. You may just need to reduce the portion, change the timing, or adjust how they're cooked. When you get it right, your joints usually let you know. Part 2. Legumes that protect cartilage. Less pain when you move. If you've ever said to me, "Doctor, I don't hurt much when I'm resting, but when I stand up, it really hurts," then the issue often isn't your bones. It's the cartilage and cushioning tissues around the joint. After 50, cartilage doesn't disappear overnight. It slowly becomes thinner, drier, and less flexible. When that cushion weakens, every time you stand up, climb stairs, turn your body, the joint takes more direct impact, and pain shows up. Some legumes help protect and nourish this cushioning layer, not with calcium, but with trace minerals and plant compounds that slow daily wear and tear. Cartilage works like a shock absorber between bones. To stay flexible, it needs micronutrients, low inflammation, steady nutrition. Certain legumes provide minerals involved in connective tissue repair plant compounds that reduce oxidative stress inside cartilage. When oxidative stress goes down, cartilage cells are less damaged, and the breakdown process slows. Many patients tell me they notice less pain when standing, after sitting, smoother movement, when walking slowly, less deep. Burning discomfort inside the joint, better movement in the afternoon than in the morning. Most importantly, these foods reduce pain during movement, not just at rest. The best way to use them: 1/2 to 1 cup of cooked legumes at lunch or early dinner, paired with vegetables, healthy plant oils, natural seasonings. Important tips: eat slowly, chew well, avoid fried foods or heavy creamy sauces. If you get bloated easily or aren't used to eating beans, start with 1/2 cup 3-4 days per week, then slowly increase. I often remind patients, pain when you move doesn't mean the joint is beyond repair. It means the joint is missing protection. Don't wait until the pain gets severe. Cartilage responds best when it's supported early and consistently. If you notice movement feels easier later in the day, pain is worst after sitting too long, then this is a food group well worth prioritizing. Part 3. Legumes that help muscles around the joints. Relax, less morning stiffness. There's something I hear almost every day in my clinic. "Doctor, my joints are really stiff in the morning. I have to walk around a bit or do a few things before it loosens up." This matters because morning stiffness isn't always coming from the joint itself. In many cases, it comes from the muscles around the joint staying tight all night. While you sleep, blood circulation slows down muscles. Barely moved tissues around the joints tend to stay tense. If those muscles don't relax enough, your first movements in the morning can feel like pulling on a rope that's been dry and stiff for hours. Certain legumes help soften muscle fibers, making your mornings feel much easier. Muscles around the joints need minerals that support natural muscle relaxation, a low inflammation environment, steady, reliable energy. When those are missing, muscles tighten. More easily, joints get slightly pulled out of alignment, and you feel stiff, heavy, and hard to straighten out. Some legumes are rich in minerals that help. Muscles relax, more fully reduce tension in the tissues around the joint, and lower the pulling force on cartilage. That's why, when muscles soften, joints naturally hurt less, even if the joint structure itself hasn't changed much yet. After a few weeks, many patients notice easier steps in the morning, less hesitation when first standing up, knees and hips straightening more quickly, less need to rub or massage joints just to get moving. Many people tell me, "I'm still getting older, but I'm not afraid of that first step anymore." To support the muscles around your joints, eat about 1/2 to 1 cup of cooked legumes per day, prioritize lunch or an early dinner, avoid eating them right before bedtime. They work best when paired with vegetables, enough water throughout the day, gentle evening movement, slow walks, light stretching. Try to avoid overly salty foods, processed foods, or eating too much in one sitting. I often tell my patients, joints don't stiffen on their own. Tight muscles are what hold joints hostage. If every morning you notice, the first step is the hardest, the joint isn't sharply painful, but feels very heavy, you need time to warm up. Before moving normally, then don't focus only on bones or cartilage. Start by softening the muscles around the joint. When muscles relax, joints move more naturally, and with much less pain. Part 4. Legumes that balance age and hormone-related inflammation. Quiet but essential. There's a type of joint pain many people overlook because it isn't sharp. but it's persistent and very hard to fully get rid of. Many patients tell me, "Doctor, it's not stabbing pain. It's just this constant, dull, heavy feeling." This type of pain is often linked to hormonal changes and tissue aging, especially common in women after menopause, men over 55 or 60 people whose joint pain worsens with stress or poor sleep. As we age, the body doesn't just lose muscle and cartilage. It also loses some of its fine control over inflammation. Hormones act like regulators for inflammation. As they change with age, inflammation switches on more easily. It's harder to shut off and it lingers longer. Some legumes contain plant compounds that reduce oxidative stress, support enzymes that regulate inflammation, help the body respond more calmly to inflammatory triggers. This doesn't create fast, dramatic relief, but it's extremely important for chronic joint pain. People who eat this group consistently often notice dull, aching pain, slowly fading joints, feeling less heavy by the end of the day, deeper sleep because joints aren't constantly uncomfortable, better mood and confidence when moving. Many patients tell me, "I didn't feel better overnight, but week by week, I felt a little lighter." And that's exactly the sign we want. With this group, less but consistent matters far more than more. What I usually recommend, half a cup of cooked legumes daily or 1 cup 3-4 times per week, eaten with a main meal, not on an empty stomach. Keep in mind, you don't need large amounts. You don't need to eat them all day. Consistency is what matters. If you have thyroid issues or kidney disease, keep portions moderate and pay attention to how your body responds. I often tell patients over 60, age itself doesn't cause joint pain. How your body reacts to aging is what matters. Don't chase something that shuts pain off quickly. Focus on what helps your body become calmer, more stable, less overreactive. When baseline inflammation goes down, joints become more comfortable naturally. Part 5. Legumes that stabilize energy. When fatigue drops, joint pain often follows. There's a connection many people don't realize. The more tired you feel, the more your joints tend to hurt. Many patients over 60 tell me, "Doctor, I feel exhausted every day, and when I'm tired, my joints bother me more." That's not a coincidence. When the body lacks steady energy, muscles around the joints don't work efficiently, your walking pattern subtly changes without you noticing. More pressure ends up on the joints, and joint pain increases, even if you're not more active. As we get older, the body processes energy more slowly. If you eat foods that cause blood sugar to spike quickly and then crash, the body moves into a state of fatigue, increased inflammation muscles that can't properly protect the joints. Some legumes have a key advantage: slow digestion, steady, even energy release, no shock to the metabolic system. When energy stays stable, muscles function better. Joints carry load more correctly. Pain often decreases naturally. After some time, many people notice less afternoon fatigue, less pain when standing for longer periods, walking without running out of gas too quickly, a steadier mood, less irritability from pain. Many patients say, "I don't just hurt less, I actually feel stronger." And that's a powerful sign for long-term joint health. To keep energy stable, eat half to 1 cup of cooked legumes, prioritize lunch or spread portions through the day instead of one large meal. Pair them with vegetables, healthy, plant oils, enough water. Avoid sugary foods, white bread, or heavily refined carbs, skipping meals, and then overeating later. I often remind patients, don't just ask why your joints hurt, ask whether your body has enough strength to protect them. When you eat for steady energy and avoid prolonged exhaustion, your joints don't have to carry the burden for weak muscles. This is one of the key reasons adults over 60 can preserve joint comfort much longer. Part 6. The joint repair activation habit. Eating at the right time. At this point, there's something crucial I want you to understand. What you eat matters, but how and when you eat matters just as much. Many patients tell me, "Doctor, I eat pretty healthy, so why aren't my joints improving much?" When we look closer, the issue is often timing and food combinations. Our joints are supported by cartilage, tendons, ligaments, connective tissue. All of these share one weakness. After age 50, the body's ability to regenerate them drops noticeably. The body repairs tissue best during a short window after eating protein. This repair window lasts a few hours. During that time, if the body has building materials and the right support factors, repair happens far more efficiently. One critical support factor is vitamin C from natural foods. When patients apply this habit correctly, they often notice less constant, dull joint pain, less of that worn-out feeling inside the joint, better recovery after a day of movement, less stiffness the next morning. And the best part, no extra medications or expensive supplements required. When you eat plant-based protein, like legumes, include or follow it with a natural source of vitamin C. Examples: leafy greens, tomatoes, bell peppers, moderate amounts of fresh fruit. Best timing, lunch or an early dinner. Avoid eating protein too late at night. Eating protein alone without vegetables, cramming all your protein into one meal. Also, drink enough water, get enough sleep. Both help the repair process work fully overnight. I often tell older patients, your body still knows how to repair itself. You just need to open the right door. When you eat the right foods in the right amounts at the right time, each meal becomes more than just filling your stomach. It becomes a healing signal sent to your joints. That's how joints are supported for the long term, instead of struggling day by day. Final message: if you remember just one thing from today's video, let it be this. Joint pain is not a life sentence of aging. It's a signal that your body needs the right kind of support. We've walked through how quiet inflammation builds joint pain over the years, why supporting joints from the inside lasts longer than quick fixes, and how familiar foods, when used correctly, can help joints feel calmer, more flexible, and more comfortable day by day. What I always tell my patients over 60 is this: you don't need to do everything perfectly. You just need to do the right things, consistently. You don't need huge portions. You don't need to change everything overnight. Just choose the right foods, eat them at the right time. Listen to how your body responds. Your joints still have the ability to improve. They just need time and patience. If this video helped you understand your pain better, feel less anxious about it, and feel more in control of your joint health, then I'd love for you to subscribe to the channel so we can keep moving forward together towards stronger joints, steady movement, and less reliance on medication after 50. Disclaimer: this video is for educational purposes only and does not replace personal medical advice. If you have medical conditions or take medications, please consult your healthcare provider.